So what is WASM doing to bring that messaging to students during the clerkship phase of their journey?
We do a lot of programming where our students are building their career profiles. So when they are entering clerkships, they're ready to explore now. They're ready to explore the day in the life. What does OB look like in practice? Now that I'm working with patients, all the things that I've been learning about in class, how do I get to apply this? The great thing with our clerkship partner, St. Anthony, is they're such a robust program, and they provide that same one-on-one attention to our students that they get in pre-clerkship. So I just actually came from one of the clinical sciences orientation, and I was working with some of our clerkship students and listening to them talking to their clinical faculty members, and they were saying, hey, I have a really interesting case. I know that you're interested in, urology. I have a really interesting case. Why don't you come in and observe with me? While it's not part of the curriculum, but why don't you come in and shadow so you can see? So just the fact that these clinical faculty are not just inviting our students into their patient lives to work with them, but also like, I want to help you explore more to find out more about the field of urology or about the field and what procedures you can see. So our students are able to explore beyond that. And I think that's an amazing thing, because one thing that you'll tend to find out when it comes to applying for residency, because it continuously gets competitive, you want that network. You want someone who's going to take you under their wing and show you the day in the life, help you get exposure so you can make a well-informed decision. But you also want that network because you want strong letters of recommendation. So the fact that our St. Anthony clinical faculty are giving our students that one-on-one attention that they're getting in pre-clerkship, our students are building their own personal network. And they're not, as Sunday and Carly mentioned, they're not just a student where it's like, we have 100 students rotating here. I don't really know who it is. Just one of you medical students come help me. They know our medical students and they know what specialties they're interested in. And so while you may not want to be a surgeon, I can tell you how this is going to apply to you as a future pediatrician and some things you can see. And I think that's amazing because our students have that opportunity to not just learn under these folks, but also explore.